Good afternoon, everybody, and welcome to Wednesday's weekly webinar. This week we're focusing on Oldham's work around coronavirus test and contact tracing. And we're really lucky to have Julie Holt with us, who is a public health specialist from Oldham Council. So welcome, Julie. Thanks very much for coming along today and sharing this with us. Test and contact tracing has been in the media a lot recently, and is a really important piece of work as we move into our kind of living with COVID phase. And equally really important for the voluntary community, faith and social enterprise sector to be involved. So a really good opportunity for us to start that discussion today, to understand more around the work that's starting to develop locally, but critically think about how the sector can be involved in supporting the work and the work with communities. So before I hand over to Julie, just pop the slide up there around some of the Zoom controls. So many of us have been using Zoom now over the last 4 months, more than we ever thought we probably would be doing. However, for people who are not as used to using Zoom, I've just outlined there some of where the controls are along your control panel. Would ask, if possible, if everybody could keep their microphones muted. It will help, unless you're speaking, it will help us to hear the main speaker. There is an opportunity for questions and answers after Julie's input. So if you've got a question that comes up whilst Julie's talking, if you could please pop that into the chat box, and I'll make sure that we, so by clicking button 3 there, and we'll make sure that I'll keep an eye on the chat box and make sure that any questions or comments that come up there, we have some time to discuss and talk through. And then right at the very end of the session, probably about 10 or 15 minutes scheduled in, so that we can discuss some ideas that we might have about how you might want your group or your organisation to be involved, in the sort of things that we can do to be involved in this work. Okay, so without further ado, I'm going to hand over to Julie.
Fantastic. So hopefully everybody can hear me, and I'm going to do a bit of an overview of managing COVID and trace system we've got, looking just as a reminder really about COVID-19, who's at risk, what it is, how it spreads, about the testing process we've got in place, understanding in terms like what is a case, what is a contact, what is an outbreak, and then looking at what people still need to do in terms of self-isolating, what are the key messages for individuals, and where to get further information and guidance. The IT system is a bit of a challenge for me here, so hopefully you will be able to hear me and you can have the presentation anyway. And if there are questions at the end that we haven't covered, you know, you can get in touch with Laura and email me and I will respond to queries. Okay, so this is what we're going to cover. Next slide, please, Laura. Okay, so in England, every local authority has to have a plan in place to protect individuals, businesses and communities in the event of an outbreak. Our plan is based on the established infection prevention and control measures that we've had in place for managing other infectious diseases such as flu or TB, etc. And the plan is available to be seen at the Oldham Council website. Next slide, please. The government set out a programme for managing COVID, and it's called Test, Trace, Control and Enable, and it's basically for us to be able to identify where COVID is, control and contain the virus, reduce its spread and save people's lives. And it's really a coordinated approach involving a wide number of partner agencies, and as I said before, it's building on the existing measures that we had in place. So this is a bit of a reminder for everybody what it is and who is at risk. If we move on to the next slide, Laura, thank you. So it is a new virus, a coronavirus, and basically like any virus, anybody can develop it, but some people are particularly at risk. And the people at highest risk are called clinically extremely vulnerable, and they're the individuals who've been invited staying at home and to moderate risk, are known as clinically vulnerable. Next slide, please. So we've all heard about the symptoms, so having a high temperature, having a new continuous cough, which we've known about right from the beginning, but then the loss or change to the sense of smell or taste was something that was identified. So that's now been added to the key list of symptoms. And for most people, this is a mild illness, and some people don't even show symptoms. But there are people who experience it very severely and people who need to be in hospital to be treated for COVID. And basically, anybody who thinks they have the virus, even if they haven't developed symptoms, can arrange to have a test. Next slide, please, Laura. So we've all heard some key messages, and this is just really a reminder of the key messages. So the first one really is around social distancing. This was originally 2 meters, and it's still now really 2 meters, unless you really can't do 2 meters, in which it's 1 meter plus, and we'll come on to that in a minute. But it's about avoiding close contact from anybody you don't live with or who is not in your support bubble. And that's even inside other people's homes. So this is trying to stay safe. The next key message is around hand washing, and this is about washing hands regularly for 20 seconds, using some where hand washing isn't possible. If you're out and about, it's using the hand gel sanitizer, using it before you go out, using it when you come back in, and if you've touched surfaces which could potentially be contaminated. The third key piece of advice is around face coverings. Now, this is relatively recently come into place, and it's about wearing face coverings to protect other people in places where it's crowded and it's not always possible to keep at a social distance. So firstly, it was on public transport, and when people go to visit people in hospital or go to hospital appointments. But now, from the 24th of this month, it's also going to be in shops. There are permitted exceptions. For example, children under 11 don't have to wear them, and people who are going to find it causes them distress or difficulty to put on or wear them or remove them also won't be obliged to wear them. But it is a legal requirement, and obviously we have to try and abide by it if we are able to. Next one, thank you. There have been some recent announcements easing the restrictions that were previously in place. So from the 4th of July, there was the opportunity for individuals to go on staycations or stay overnight in this country. Some businesses were able to open, including hairdressers and barbers with suitable protective equipment. Pubs were able to open and provide food and drink following guidance that was issued. And this is where the 1 meter plus guidance came in. People really should stay 2 meters social distance from each other, but if really that isn't possible, having other mitigating measures in place, such as the face masks or face coverings. Next slide, please. For the people who were shielding, the Monday the 6th of June, there was an announcement around the easing up of shielding so that people could meet a few more people, but outside, because outside it's less likely for the virus to be transmitted and it's easier to keep at a distance. But from the 1st of August, the guidance is that the people who have been shielding will no longer be advised to shield. So they will no longer have to shield. For those individuals, some of whom will have been receiving support from the local authority or community and voluntary groups, so support will still be available. So people who perhaps needed to access emergency food support, access emergency delivery of pharmacy medications, or non-food supplies, they still will be possible. Moving on then to testing. Testing was initially provided really for patients in hospital and the NHS staff who cared for those patients. It's then been expanded to residents of care homes and social and care staff. And now testing is available for employees of key businesses and for the public. And in Oldham, we're able to offer some testing for people without symptoms, as well as people who have got symptoms of COVID. And I'll mention that in a bit more detail. So in Oldham, we've had testing facilities available for health and social care staff at Failsworth and at the QE Hall. We've also had a community swabbing team that has gone to visit people who can't access other facilities, so residents in care homes and people who've been housebound. We've had some military defence mobile testing units, which have mainly been on the Rock Street site in the centre of town. And more recently, we've had a walk through prototype site, which has been next to the library in Southgate Street in the centre of Oldham. And we've also been able to access some home test kits for people who can't go to sites. So who can access testing? Well, anybody who has symptoms of coronavirus can access the NHS website or ring NHS 119 to arrange either an appointment or for a delivery of a home test kit. If that test comes back with a positive result, the person's information is shared with the contact tracing team, either on the web tool or to a phone-based team, to arrange tracing contacts to advise them to self-isolate and to prevent the spread of COVID. Next slide, please. Okay, so we talk about a case, and what is a case? A case is somebody who has proved positive for COVID. A possible case is somebody who has the symptoms, but is perhaps waiting to be tested or is waiting for the results to come through. Basically, this diagram, which is probably quite small print, so hopefully you can see it, identifies if somebody has symptoms and they self-isolate until they can get a test. When they get tested, if the test is positive, then they have to self-isolate. If the original test is negative, they can carry on with their lives, and the social or household contacts are also free. How many cases are there in Oldham? We've got lots of data and there's a lot of information here, and it might be a bit much for me to go through all of this, but you can have the slides. But just basically, this shows that we did have a peak in April of the highest number of cases in Oldham. And then gradually, although it's gone up and down a little bit, it's on a downward trend. Next slide, please. This slide compares Oldham's rates with other places in Greater Manchester and England. And it shows that Oldham's rate has been higher than Greater Manchester and England, and part of that was probably because we were doing a lot more testing. So if you look for cases, you tend to find cases. Next slide, please. Again, this is another slide showing the positive tests in Oldham. This is an average over the last 7 days, so it's what they call a rolling average. The two colours of the test pillars show initially pillar 1 testing was just when we were testing patients or NHS staff. The orange pillar 2 testing is for the other commercial testing, which has been testing done through military of defence and through other testing sites. Are you able still to hear me? Yes, okay, thank you. My screen went off then, which was a bit weird. Sorry about that. Okay, So we're trying to look at details of the people who have positive test results, and this one is by ethnicity, and shows that there were higher rates in some particular ethnic backgrounds. However, we do have to say that we only get a certain amount of data, so we don't have a complete picture of all of the people who have had tests, and that causes us a little bit of difficulty. So we only get a partial picture of what's happening, and we're trying to get further information to help us develop our understanding of which particular groups in the population are more affected by COVID. Next slide, please. This slide shows cases by age and gender, and we can see that from this, a higher number of women than men have received a positive test. And this one shows the number of cases and deaths from COVID. Now, this is a couple of weeks old, and I haven't got the more recent deaths, but again, you can see that the numbers of cases and deaths are gradually declining week on week. This is another one. This is relating to hospital A&E admissions, and again, from the peak in early April, you can see that the figures are gradually showing a decline, slight blips, but as a rolling average, the trend is going downwards. This from our hospital data shows that statistically there was no difference really in different population groups in terms of hospital admission data between BAME and white British and Irish groups. Men were more likely to be admitted than females, and the admission rate varied by age. So those who were younger were less likely to be admitted than older people. So this is just a summary. We do look at the data across the different districts, and although it may vary from week to week, overall there's been a similar number of cases in each of the different districts. Next slide, please. I just wanted to pick up what I mentioned before about people without symptoms. As the pandemic has progressed, we've realised that more and more people may have had COVID or may have COVID currently, but aren't showing symptoms. And through the national system, people without symptoms haven't been able to access testing. But in Oldham, through our prototype site, we are now providing testing for people who think they may have the virus because they've been in contact with people who have had the virus, and we're offering them testing. We're doing this through certain groups, so certain businesses, certain occupations, and we are exploring how we can expand that option for people who don't have systems. Oh, flipping heck, I can't even get my words out, who don't have systems to access testing. Basically, if somebody is tested as positive, regardless of whether or not they have symptoms, they do need to isolate. And it's helpful for their household to make sure they follow good infection control measures. If we move on to the whole contact tracing system, this quite complicated slide, and I don't expect you really necessarily to be able to take it all in just at the moment, but if you have any questions about it, you can get in touch. It shows that nationally there's 3 layers of a system. It's not been numbered very clearly, but the first layer is the one on the extreme left, which is Tier 1A, which is a national coordination role, looking at the governance of the whole system and providing guidance. The one on the complete right is the National Tracing Service, Tiers 2 and 3. Tier 3 is a national phone-based contact tracing system, Tier 2 is more specialists who do more contact tracing. And then for complex cases, it comes down to the level in the middle, which is labelled Tier 1B. And this is a combined hub of people from the Northwest, from Greater Manchester, Public Health Northwest, and Oldham fits into this collective group. And this is where complex contact tracing takes place. If you go on to the next slide, please. Go on to the next slide, please. So in Tier 1B, which is a team covering Greater Manchester and Oldham, we are going to be contact people who are the contacts of people who have proved positive, who are in these complex settings or complex organisations. So, for example, it might be perhaps people who have learning disabilities, or people who have been rough sleeping, who are in hostels, or people who are in probation hostels, or people who have people who we've been asked to do the contact tracing of locally, because our local knowledge and support systems would be helpful with that. The other areas that we are involved in this level are providing support for individuals who are shielded and vulnerable, who might find it challenging to self-isolate. So that's linking into the local hubways and the contact centre, the support that's been available for providing emergency food, medicines and non-food essentials. We also are responsible for managing the consequences of outbreaks. And as I'll point out in a moment, an outbreak is two or more connected cases in a setting. So that could be in a business, or it could be in a maybe a large family household where maybe more support is needed, or there might be other consequences of an outbreak that we would have to manage from a council perspective. And we're also able to provide advice and support to settings, so schools, nursing homes, businesses, etc. Next slide, please. So, what is a contact? A contact is somebody in the 48 hours before and the 7 days after somebody else who they are in contact with has developed symptoms or has had a test. Household contents, so that's people who live in the same house or in shared accommodation, for example, if they were students or perhaps living in a HMO. People have spent significant time in another person's house, people who are in sexual contacts with others, and people who have been involved in cleaning for other people who haven't been using PPE. Then we have people who don't live in the same household but still may be in direct contact with an individual, or somebody who's travelled in a small vehicle close to somebody who has tested positive, or people who have been within 2 meters of an individual for more than 15 minutes. And then finally, this is one that's becoming perhaps potentially going to increase more, is people who've been on an airline with somebody who has tested positive, because travel is being allowed more and people will be coming in from other countries. These definitions for contacts don't apply to people who work in the health and social care settings, who as part of their normal job have been wearing protective equipment. I mentioned an outbreak, and an outbreak is 2 or more cases that have confirmed a link in time, place and person. And for COVID, it's in the same setting within 14 days, because the transmission disease lasts on average between 5 and 14 days. So that's why that's considered an outbreak. Moving forward, What happens to individuals who are either themselves positive or are contacts of people who are positive? This is the national diagram showing on the left what people need to do who themselves have symptoms. They need to isolate, book a test, and let NHS Test and Trace know their contacts so that they can start contact tracing people and reduce the spread of the virus. On the right, people who are in close contact with somebody who've tested positive, they may be alerted by Test and Trace, and if that's the case, they need to self-isolate. They can book a test for themselves if they develop symptoms, and their family also needs to isolate as well. There are posters that are being distributed about self-isolation and what to do. And these are the key messages. So these are the messages that we've had previously about staying at home, not going out, avoiding contact with other people, maintaining those good hand washing procedures, covering coughs and sneezes, and cleaning frequently, and not having visitors in the house. As I mentioned, the good news is that many people have experienced COVID and they have had, if anything, only mild symptoms. Some people haven't had symptoms, and the majority of people do survive COVID. We do hear a lot about people who have been ill, been in hospital, and sadly people who have died, but the majority of people do survive. There is a lot of guidance out there for people who are contacts of people who have COVID, for people in different settings. Next slide, please. There's lots of guidance for different sectors, including schools, businesses, for opening up community centres, for faith settings and organisations. And we in public health and environmental health have proactively advised different settings, and we can provide advice too. We have a specific email address which people can contact us at. So that's enough from me at the moment. Are there any particular questions now that we can look at?
Okay, thanks very much, Julie. I'm really pleased to say that for the majority of it, the audio held out. And so thank you very much. Really, really informative. I'm just going to go into the chat bar now and just see. Okay, so we've got a question in. So first question from Sharon. And anybody who's got any more questions now, please do pop them in the chat. And we've got a question from Sharon Hibbett, who's based at Upper Mill Civic Hall. And at the moment, they're not using the halls for classes. She's asking what is the potential maybe for the hall to be used as a testing centre? That's a really good question, Sharon.
That is a really good question, and certainly it's something we want to think about. Up till now, testing centres have really been outside, but going forward, we will be getting permission to be able to host some testing centres inside. So if that's something they're interested in, I will take that back into the group that looks at testing and see whether they can do a risk assessment and what it would take for that to be a possibility.
Thanks, Julie. And I think, you know, some of the things we're going to go on to talk about in terms of how could the sector be involved, you know, one of the things that I've been interested in and I've heard from others like yourself, Sharon, is around how can voluntary community organisations and their buildings be involved in hosting potential testing sites. And that's something that I'm really, really keen to explore. Okay, is there any other questions on any of the information that Julie has presented? Any other questions maybe for Julie? Okay, so a question in the chat from Culzum. Culzum, do you want to pop your microphone on and maybe ask a question, and maybe let's try and have a little bit of discussion at this point.
Yeah,
and hopefully Julie will stay in.
Yes, I'm on. Just hi Julie, thank you for that. That was really interesting. Lots of information there, and it's good to see the clarity in terms of what's the message has been going on. My question was really, or a bit more clarity really, on the on the slide when you presented the ethnicity, obviously quite clearly I noticed that the Pakistani community was the numbers were far greater in the Pakistani community, and I wasn't quite sure. Maybe I missed it a bit because I know that the audio was a bit shaky on my side as well. Could you just give a bit more information about that slide, please, or just kind of go over what you said? Didn't quite hear everything that you'd actually said. And just clarity around, when you said that not all the data's in, what do you mean by that?
The challenge we have around the data is that the test results go to individuals to let them know that they are positive for COVID. And usually in the terms of notifiable disease, of which COVID is one, data also goes to the Director of Public Health with detailed information to help manage outbreaks or prevent transmission of the diseases. There has been a particular challenge around the provision of information around ethnicity, about employment, for people who have proved positive. So not all of the testing routes have been able to provide that information. It's starting to improve now, but that has been a real challenge. So it has made it difficult, because what we would like to do from a public health point of view is to obviously work with different communities who are perhaps either more at risk of developing COVID or seem to be experiencing COVID, to work with them particularly to make sure that messages are getting through, that people are understanding what is required, that they're having access to testing, that they're managing to self-isolate and get the support they need. And there is activity taking place to try and get more information so that we can have more tailored communications with different groups.
Thanks, Julie. I think just to add to that, Coulson, as well. So we had a presentation at the Equalities Advisory board last week, which I think a few of us in the room are members of that board as well. And I think some of the challenges and frustrations, if I can be really honest, locally have been around the data that we've been able, that the health and social care system has been able to access nationally. That local data coming in. So one of the key bits, which is really frustrating, in my opinion anyway, is that we don't yet have the total number of tests that have been done. So the data we do get is, this is the number of positive tests, but we can't weigh that against, this is the complete number of tests that were done. This many were positive, this many were negative, and then breaking that down by ethnicity. Again, we're not able to do that. So that's been really, really challenging. I guess the key message is that the data is improving all the time. Oldham has been, as a place, have been lobbying nationally to get some of those improvements in the data, and that I feel like we're just building the picture as we get more and more data streams coming on, and we can kind of use that to build a better picture to help us understand better what's happening in our communities. But the data, I'll be honest, I think the data is really important, of course it is. But the other thing that's equally as important is the insight from communities. So kind of understanding what the data tells us is important, but equally understanding what it feels like for people, and what the talk is, what the sense is within some of our communities is equally as important, I think, around this. And I think that's, partly where there's a big role for community organisations, for charities, for voluntary groups to be involved in that. Does that answer your question, Coulson?
Yes, it does. Thank you. It does definitely. I think, like you said, as the data kind of unfolds, and yes, I was on the forum last week as well. As data unfolds, it will become more clear in terms of what it's looking like. It's just that slide obviously was quite, was quite alarming, really, because the community was obviously, as you can see, it was quite high on there. But it does make sense. Thank you very much for that.
Well, that's
watch
okay.
and see then is what I'm hearing. Let's watch and see how the data is kind of unfolding, just to kind of see how it's presented.
Absolutely, and I think the other important move as well is that putting that data in the public domain, so that any resident in Oldham can see the data, can understand how many cases there are in Oldham. That's been a really important move, and I think Oldham have managed to do that now, and that's, I think, really, really positive. And it's incumbent on us to be sharing that and to help people who maybe are concerned or worried to be able to go and find the data to see the numbers, because I think there's been this thing around some of the national headlines in terms of numbers of cases, but also in terms of some of the disproportionate impact upon ethnicity. And some of the national headlines are very fearful. They're very scary. And I think that actually some of the locally that looks slightly different. And I think when people can understand and see that, it helps to overcome some of that fear factor. I'm just looking in the chat box. I can't see any more questions, unless anybody has a question and they'd like to just indicate in the chat box that they've got a question or that they would like to speak. Shall we try and turn our cameras on and see if we don't... Oh, Coulson, sorry, you've got your hand up.
Yeah, me again. Just like to ask you, Julie, you mentioned about the and this morning I received something as well in terms of communication comms that have been sent out for the publicity for social media and in the different languages. That was really great to see, but I don't know if this is the right forum to kind of mention that. Is the social media publicity out in the different languages as well, like in Bangla? And I did make a comment and I sent it back to Jonathan in terms of the actual font that was used for particularly for the Urdu poster, which was really quite difficult to read. So I don't know if that's your department, or is that just
Every department's my department. No, I'm only kidding. We've actually got Duncan on the call, or he certainly was. Duncan from Oldham Council comms team. Duncan, is this one that you could speak to? I'll just see if are you still there, Duncan? I'll just unmute you. See if I can help you. Hi, Duncan. There's just a question there from Coulson around the translated comms materials. I don't know if you managed to hear the question. Okay, I'm sorry, guys. I'm struggling to hear from Duncan there. So I think if we make a note of that, Coulson, then, and if we pick that up outside the webinar, would that be okay?
That'd be great. Thank you, Laura.
So I think what I'm getting a sense of is that it's great that we've got some translated comms materials, but the font isn't particularly helpful, and therefore it would be good if we could just, I think they are national comms materials.
I am hoping the others members that are on the group will comment as well. Maybe it was just me, but it was quite difficult to read. So yeah, thank you. That would be great if that can be picked up maybe outside of this.
Yeah, no, that's really helpful, and I think we can there's probably something in that for the next sort of conversation that we're going to move on to, unless anybody's got any other questions. Okay, shall we try and put our cameras on? And I'll apologise to Julie now if it absolutely crashes your system, but there we go.
Ooh. Oh, I saw one person, Phillida.
Hello.
Hello. I've seen a few people, but
yeah. Well,
exciting.
It's always tricky to do a webinar, and when you're doing a webinar and you can't see anybody, it's even trickier, isn't it? So apologies to everyone. We do prefer if we can see everybody, but I think with just the particular connections issues for Julie, I felt it was more important for you to hear from her than for us to see each other. But I guess we've kind of got 10 minutes left of the webinar, and this, if there's no other questions, this was the bit. Really,
yeah, I think it's my sister.
Thanks, Julie. Yeah, I'll Okay, so I think we've got sort of 10 minutes left. I'm really keen to hear from everybody on the call then around kind of what do you think in terms of how could the sector be more involved? How could your group or your organisation be more involved? I think from Coulson there was a conversation around the kind of the key messages and the comms materials, and those national materials that have been provided aren't right because you can't, even though it's translated, you can't really see you can't really read it very well. So, you know, if we're going to develop some local stuff to support this work, you know, how would you want to be involved? How could you be involved? And what would you need to be involved as well? I don't know if anybody's got any ideas. Sharon's idea around, you know, the community halls being used as testing sites. I think that's a really good idea. Anybody else? Camilla, I don't want to put you on the spot, but you looked like you were about to say something. So please.
Sorry, I've just been thinking about a conversation I had today with my staff team, because we have a daily catch-up. We're all on furlough. And the messages that people are reading and picking up are coming through from the national stuff. So the Guardian's highlighted Oldham as being, I don't know, 5th worst in the country for COVID cases. And those are really powerful messages. So every conversation I seem to have with anybody from Oldham in my sort of sphere is how bad it all is compared to everything else. Now, I know there are data issues and complexities and what have you, but I think something that sort of perhaps puts some balance on where Oldham is, you know, because we're sort of looking at getting back to work against a backdrop of, well, you know, we're going to be in a local lockdown in the next week or so, is the sort of sway of opinion. And obviously we work with people with learning disabilities. So really sort of key, clear messaging is really important for them to understand what's happening as well, or for people who are talking to them to be able to sort of give them a realistic message. So not false hope, but equally, if it's not that we're going into and we're not overtaking Leicester, then, you know, those messages need sort of somehow getting out as well, I think, was just an observation, really.
I think that's such an important point, Camilla. So there's two things in there from what you've said. So the first thing is the comparison with the national headlines and the media headlines. So just by comparison, in the 7 days before Leicester went into their local lockdown, there was 143 maybe confirmed cases. The same week in Oldham, there was 20.2, I think, in the 7 day period. So there's just something about the proportionate of that, how proportionate that is. Yeah, I absolutely agree. And I think there's a huge role for community organisations, voluntary groups, and charities, people on the ground who are working, even if it's virtually or by the telephone currently in our communities, to be armed with the information that helps to have those conversations at the level, in the right place at the right time as part of the conversation, but be armed with the facts almost. And there's something about how do we share the facts better with each other. And then the second thing I think you were saying, Camilla, was about there's particular audiences as well. So in terms of your work with adults with learning difficulties, there's a real skill and expertise around those key messages. And for Coulson and others who are working across, you know, some of our BAME communities, for example, I know we've got Becky and Dawn on the call in terms of kind of some of their work with young people. We've got people on the call who work with older people. So, you know, there's kind of there's things to consider, and you are the specialists, you are the experts of working in those communities. So there's something very clearly about that key messages and having those daily, day-to-day conversations about the situation. Yeah.
Or simply something that sort of says, look, this is in the press at the minute, but actually this is what the facts are, you know, so that we've got that context and scale, really.
Yeah. There's something about trust as well, isn't there? So, you know, there was a survey done recently about how much do people trust the government as opposed to how much do people trust their their local community organisation or their advocate, or and the trust is much higher, as we know. So there's something really important about that as well, isn't there? Thanks, Camilla. Anybody else, any thoughts about how your group or organisation might want to be involved beyond the kind of some of the key messaging stuff?
Laura?
Yes, Julie?
Can I just say, I don't know if Duncan is still on the call, but the message about how we counter some of those national messages, I think we need to feed back to Duncan.
Yeah, absolutely.
Because, as you say,
yeah, no, you're right, Julie. Absolutely will. It's really important, and it needs to be part of that kind of what the ongoing strategy is around how we. I think Duncan must be having similar problems to you, Julie. But yeah, it's really important that it forms part of the strategy, and the stuff we're doing here, it's not just us having a nice conversation here. It's about what do we kind of do with it next, and how do we take it to the next stage, really. And I'm really keen for us to develop up for Oldham, for the voluntary sector in Oldham. This is what the voluntary sector offer could be around support for testing and contact tracing, and this is what we need to do that well. So this is the sort of the first conversation really with yourselves around that, but I want us to very quickly build something that we can so that we can join it all up. Okay, last 5 minutes then is I don't know, Becky, you've just come off mute. Did you?
Hi, yeah. Hi, everyone. Yeah, just going back to trust, Laura. Currently, me and the team at Full Circle are furloughed, but we are supporting the helpline and doing a lot of shopping for elderly people. Now, with that slowly coming to an end, sorry if you can hear a child screaming in the background, she's not being murdered. The more and more I talk to these older people, now it's coming to their end, because they've been locked down, they're so anxious now and so scared of still going out. And the question is now, well, what do we do now, Becky, now you're not going? And because they've built that relationship up with me for 3 months, it's that panic and that, well, what do I do now? And, I've explained that they kind of go back into the system really and potentially get other people, but that even scares them more. I know what's on the shopping list before they do now. We've got that relationship. And that's quite scary and quite scary. The whole track and trace thing, they don't understand. They're becoming overthinkative, becoming a lot about all these conspiracy theories. And then, like you've said, Camilla, about the headlines are really scary. And then even Full Circle are thinking, well, I live in Rochdale, so if Rochdale gets locked down, can I go and work in Oldham? No, it's kind of all that. And then obviously we go to the young people. The more and more they're getting fed up of being indoors, the more and more we're seeing groups of young people hanging on the streets. Yet the youth workers are out on the streets. They're not in the youth clubs, and young people come on board, which is going to get worse. And it's how we're getting that message to the young people and their responsibility within this. If they get the infection, they're going to take it to grandma, they're going to take it to mum, and so on. But then you've got the trouble with that as if a youth worker's on the street and they go over talking to a group of 10 young people, then you've got the neighbour coming out saying, well, you're encouraging it because you stood with them. And it's how we get past that, and how as youth workers we're seeing important and needed on the street. And me and Dawn and the whole Full Circle team want to be involved in that education and getting that message out. So in any way we can do that, we're available really. And the same with the older people that we've got them relationships with, if we can support them back into the community, support them more into the everyday life and getting the confidence back. That's not our specialism, but we've got them relationships now with them older people, so we can help that way, then we're more than happy to do so.
Thanks, Becky. Some really, really important points there. So the stuff around the transition for as shielding ends, the transition into what does that new support look like, that support's still available, but what does that look like, and is it right for the individual? Like you say, the shopping list before they do. There's something in there I think that we need to talk about really quickly around what that looks like. And I think the last thing that we need to be doing right now is to is to break trust with some of our more vulnerable residents, and break those relationships, because it just gets more scary then, doesn't it?
It does. A few in particular that, you know, they've come into tears thinking that they're kind of losing that relationship with that trust, really, because I've been their lifeline, really. So it's how, you know, we can continue supporting it but keep that trust up, definitely.
Yeah, I think that's so important. And with my community response bronze hat on, can we have a conversation after this around some of that, Becky, and think about how we transition that? And then the young people bit, really, really important. So it's come up from Madlow and from some other young people's organisations around that tension in the community of being out doing kind of detached youth work outside and doing it really safely, but what the community perception of that is, and not necessarily being considered as a frontline worker, when actually what you're trying to do is all those key messages around young people becoming super spreaders, and particularly with their, you know, older members of their family. I think there is a really, I mean, Julie, you might want to correct me here, but I think there's a really important bit about this around children and young people, because whilst we know that the virus is affecting them in terms of the impact on the individual is less the younger you are, what we're actually seeing in Oldham is that our positive cases are tending to be in the younger age group. I think one of the slides you showed, Julie, am I right? I don't want to say something wrong there.
Yeah, we are getting cases in younger age group, and also we have to think about people who live in families where there's multiple generations as well, as you say, who can spread the COVID to older members or more vulnerable members. And I think also now more people are going back to work, children will be going to school, the potential for people mixing, you know, with people that they haven't mixed with before and picking up the virus is greater, isn't it? So we do need to keep re-emphasising those messages about social distancing and hand washing, etc. And the right people need to do it at the right time. So if it's Becky and Dawn in the contacts they've got, or other people in other settings, then we need to all be sort of reinforcing the right messages, really.
Yeah, absolutely. Thanks, Julie. I guess there's another idea that has been mentioned by a couple of groups and organisations sort of before the webinar around a way in which they might want to be involved, which is around kind of proactively supporting actual physical testing sites. So I know when Julie gave the presentation and outlined kind of where the current testing sites are. So we've got a newish, is it about 3 weeks maybe, the pop-up site at the library, and the insight from the team, the G4S team who deliver that, is it G4S or Deloitte? Anyway, the commercial team who deliver it, that is, there's insight around, there's people who are walking in who are curious, but having some Oldhamers there, some friendly faces, particularly if there's language barriers, or just some friendly faces from the community to help to explain the process and to encourage people to access testing, would be really, really helpful. And there's a couple of groups and organisations who've approached who said, you know, that's something we'd be really keen to think about in terms of some of our staff or volunteers. And it might also be around when we're thinking about are the community venues as we go forward and it becomes safer to do testing indoors, you know, can we use some community venues as testing sites? Do you think there would be appetite and the kind of people that are here for your organisations or organisations, you know, to kind of get involved in that sort of stuff, those kind of roles? Maybe. I mean, maybe it's... Oh, hi, Jan. Sorry, Jan.
Yeah, I think with the Primrose and Crossley Centre, I'm sure the trustees would be up for using the centres. We've not had anyone using them since lockdown, and we're not going to be having any classes or any sessions till it'll be September the earliest. You know, we're just at the stage where we're putting the risk assessments, everything in place. And then we've got to have it all approved by Great Places as they're managing the centres. But in the meantime, you know, if they can be used, I'm sure they'd be quite happy for that. Okay.
Thanks, Jan. That's really helpful. I think there's there's something around encouraging everybody really to be tested. I think it's, if you listen to some of the World Health Organization stuff, and also the stuff locally from our Chief Medical Officer, Dr. John Patterson, he is a champion of test everybody. The more people we test, the more we know where the virus is, and the more we can control it. So we're not there yet in able to do that, but I think that is where we want to be at locally in Oldham. We want to know absolutely everybody has been tested, and absolutely who is positive at any one time or who isn't. And in order to do that, and in order to get the confidence of community members and residents in Oldham to do that, I genuinely think it is about putting those testing sites in non-clinical community venues, places where people would go to do other stuff. So if they used to come into Primrose Centre for a class, pop down there and have your swab done, have your test done. It feels definitely less scary, I think, and that's some of the reflections of people who've been for testing that are telling us that, and also community groups who want to get involved. So thanks for that offer. It's a really good one, Jan. Okay, I'm conscious of the time and we're about 5 minutes over. Just picked up a couple of things in the chat box. So Duncan was trying to get in to have that comms discussion, but he's got technical issues, but he can listen in. So he said he's taking on board the really important views, and I know that Duncan will be keen to follow some of that up and work with us on that. And then also Maggie Hurley, your microphone isn't working, Maggie, so unfortunately you've not been able to contribute. So I think unless there's any last sort of questions or any other suggestions about how we would maybe like to be involved in it, I guess we'll draw to a close there. I hope you found it useful. I hope that if you have any other questions that occur to you, following Julie's presentation, then do get in touch with Julie. We'll put on the website Julie's contact details, and we'll put the presentation slides up there, and also the recording from today, if you wanted to go back over it. But yeah, thank you very much for joining. It's been lovely to see you all for the bits we could see you, and we hope to see you all soon. Okay, thank you very much, everyone.